Hello, everyone. We're going to start this week's webinar. Welcome today to the Alberta SCILS or Alberta Spinal Cord Injury webinar series. My name is Adalberto Loyola Sanchez. Everybody knows me as Beto, and I'll be your moderator for today. Some of you know me, some of you don't. I'm a physiatrist, and I'm part of the spinal cord injury program at the Glen Rose Rehab Hospital here in Edmonton, and I'm very excited to host this session, which is an update of our inaugural session of this SCILS series, which is Wheeling Around COVID, an update, and with a very specific message, which is don't let your guard down. Before we start, I want to acknowledge the participants so far. So, hi Mark, hi Bean, Christy, Luis, Judith. Oh my God, I don't know how to see everyone. This is a new format as well. So now we're trying to see, as you will see, this is not a webinar format anymore. It is a format of Zoom. So you will be able to interact with others and you will be able to see who is in here. So we're excited to know how this is working for everyone. Before I present our speakers, I want to go through some housekeeping rules. So first of all, you know, the overview of this webinar is going to be a format of first, a conversation of our two experts. We have our knowledge expert, our professional expert and our lived experience expert. And once that conversation and discussion ends, we will open up to questions to the audience. But in the meantime, please use the chat box for any questions or any comments you want to do. I will be personally overlooking that and making a synthesis so I can present it back to the presenters. All attendees are currently muted. So once we open up the webinar for questions, please raise your hand. How do you do that? Do you do that? If you go to your screen and look for participants, the button for participants, which are, at this moment it says we have 12 participants, then you will see the icon for raising your hand. And that's the way you do it. And once you are given the turn to talk, you could either keep pressing on the space bar key on the keyboard, or we will unmute you from our end. And also you can choose to rename yourselves. That's another important point. Like if you want to remain anonymous or whatever, you can change your name, going again to that option of participant, and then you go to your name and there is a button there that it says options. If you click on options, you have the opportunity to rename yourselves. Finally, we will have two polls, one at the beginning and one at the end. These polls are very important. So please, I ask you to make the effort to answer them, because we use these polls to improve the quality of this seminar, but also to attend to strategize how to make this better in terms of reaching out and in terms of the potential impact that we could have. So with not further ado, I now have the pleasure of introducing to you our presenters today. So on the side of the lived experience expert, we have Eric Dyke, who is a man with a spinal cord injury and an active member of the spinal cord injury community. And on the professional expert side, we have Dr. Janice Richman Eisenstadt. A lot of you know her already because of that initial Alberta SCILS presentation. She's a lung doctor specialized on neurological conditions that affect breathing, and she's part of the Glen Rose Rehabilitation Spinal Cord Injury program. So I would like to welcome all of them, and before starting, remind all of you that there is currently a rehabilitation advice line from Alberta Health Services that is that is a phone service similar as to HealthLink, but specifically for people living with disabilities in the province. So if you have any issues or any concerns in terms of your functioning or your disabilities, you can call this number, and this is a fantastic support system that we are creating as well. So I'm gonna stop sharing my screen and I will open it up to Dr. Janice to start this webinar.
Thanks, Beto. I'm really excited to be presenting with Eric on an update about COVID-19 and especially about how we must not let our guard down. So it's really timely. So COVID-19 is a viral infection caused by the virus SARS coronavirus 2. The first case in Alberta was identified on March 5th. By mid-March, Alberta went into lockdown, and we had the peak number of cases mid-May, May 10th or so. Things got better because people were listening to the advice of our public health specialists, and we were able to start stage 1 reopening on May 14th. And we were doing so well, we opened to stage 2 early on June 12th, which meant we could have more people, more businesses open, we could start doing more and meeting with more people. However, by mid-July, with this reopening, we started to notice an increasing number of cases. So as of August 6th, we have in the province we've had a total since March 5th of 11,300 cases or so, of which 1,143 cases are active. That's a lot. And of those active cases, we have 68 people in hospital. And of those 68 people, we have 18 people in the ICU in all of Alberta. Keep in mind that at the peak of, during March, April, May, we had only we only hit a peak of maybe 22, 24 in ICU, something like that. So we were up to 21 in ICU a week or two ago, and now we're down to 18. But this clearly tells us we cannot be letting our guard down. So with that in mind, I want to talk to you now about what we've learned since March. So 5 months with our experience in Alberta, but now about 7 months global experience. There's some key things we've learned about this virus, and we continue to keep learning more things about this virus. It's a new virus. Scientific American, the August 4th issue, had a really good summary about what we've learned. So I'm going to summarize some of the key points there. First of all, we've learned that outbreaks can happen anywhere. It's not just in, the food markets of China or the crowded subway stations of New York. This can be anywhere, rural, urban, in the home. It can be in meat factories. It can be not just from airports. We've had outbreaks from it globally. We've noticed that when schools open, outbreaks happen. As people go back to the pubs or restaurants, outbreaks can happen if we don't practice the recommended public health prevention strategies. Meat markets have been the meat factories have been another source. So basically, this can happen anywhere. Outbreaks can happen anywhere and at any time. The next thing we've learned, and this is really important, that COVID-19 can sicken and kill anyone. So at first we thought it was just elderly people and very sick people. We've learned it's the elderly, it's middle-aged, it's young adults, it's kids, it's babies. Anyone can get sick, anyone can, and it can kill anyone because the intensity of the disease can be severe enough to cause death in anyone. So no one is really immune. And we have not learned how to tell who's going to be immune, who's not, who's going to have severe illness, who's not, who's going to be one of those people who have mild disease, and 80% might have mild disease, just like we identified in March. That doesn't seem to have changed. But the other thing, there's some other things we've learned. we used to be really, really careful about contaminated surfaces, thinking that this could be, you know, the virus can survive on these surfaces. And we had all this advice of how to clean. However, we've learned that contaminated surfaces are not the main danger. Here's why, because the other thing we've learned is the virus is expelled in a range of droplet sizes. And some of these particles are small enough to persist in the air, especially in indoor and poorly ventilated spaces. The other thing we've learned is that many people are infectious without feeling unwell, without being sick, and maybe they'll never get sick, and some of them will get sick. But we've learned that people who aren't sick, who have the virus but aren't sick, or who aren't yet sick, can spread the virus, can contaminate others. So in other words, between the droplet spread and asymptomatic people who carry the virus, we can simply spread the virus by breathing, by talking. So the other thing we've learned is that the virus is not slowed by summer months or warm weather, as is influenza. So with all of that in mind, masks work. That has been one of the most important lessons. But masks protect others from getting infected, and to a certain extent it might protect us, but the biggest reason to wear masks is to protect others. The other major thing we've learned and continue to learn is about the nature of this disease, that some people might not have symptoms ever when they contract the virus. Some people might not have symptoms for a while and then get sick with the virus. Some people might have a long recovery with mild symptoms. Others might have a long recovery with moderate or severe symptoms. We also know that some people have severe illness and will go to the ICU. Some will recover, some will die. Some really key things about this virus that we've learned. Initially, we thought we needed to check for fever, just the way SARS and MERS presents with a fever, and this is a hallmark of that. Those corona-type viruses, COVID-19, this coronavirus, may not present with fever. And in fact, many people presented to the emergency room not feeling well. They had not yet developed a fever. Many of them went on to develop a fever, but initially they didn't have a fever. The other very unusual thing, and probably one of the unusual neurological manifestations of this illness, is that people can have very low oxygen saturation. So if you were to check your oxygen saturation, people would be coming in and they wouldn't feel breathless, but their oxygen saturation was really, really low. We don't understand why, but we think this is somehow the virus has affected the brain. And we've learned the virus can affect the brain, affects the lungs, but it can also affect blood vessels and cause clots in major organs as well as in limbs. So this can be, and we're still learning more. This is quite a serious illness and very contagious. So who is at risk? We've learned, we already knew back in April when I presented initially that people who are smokers, people with diabetes, and people with hypertension are at higher risk. We also know that people with less breathing reserve or a weak cough are also at risk, as they would be for any viral respiratory infection. We also know, as we knew in April, that this virus affects the T-zone. It comes into our bodies through mucosal surfaces, not through our skin, but through our nose, our mouth, and it can also come in through our eyes. So as much as we've been advised to wear masks, recently Dr. Fauci has advised considering wearing goggles or glasses or visors to also limit the spread or catching the disease. And 5 months in, we still have, in Alberta, 8 months in worldwide, we still have no cure. There's a lot of candidate treatments, but most of the care for someone who is sick with COVID is supportive care. There are lots of recommendations and trials going on, but we do not have a cure. We also do not have a vaccine. And as much as as there are several vaccine candidates that are in testing mode, but we'll be lucky if we've identified a really good vaccine candidate by the end of the year for mass testing. But that doesn't mean we're going to have an answer by the end of the year. It probably won't. People are predicting maybe sometime in 2021 and more likely 2022, because we don't know which virus of all the viral candidates is going to work. How long is it going to last? How effective is it going to be? Is it going to be like the flu vaccine where we don't get as sick? The flu vaccine reduces the intensity, but it doesn't stop us from getting sick with the virus. Is that what the COVID virus is going to be like? And then is it going to last a long time? Is it going to be lifelong, or is it only going to be for a period of months or a period of a year? We don't know. So with all that in mind, we clearly cannot let our guard down. And with that in mind, Dr. Theresa Tam, Canada's Chief Public Health Officer, is telling us, as recently as last week, we're in this for the long haul. COVID-19 isn't going away anytime soon. And we need to be prepared for this to be 2, if not 3 years in length. So as much as we had hoped for this to be a quick pandemic and have it over, it's not going away anytime soon. So the best current strategies for dealing with the pandemic is prevention and all the public health measures that Dr. Dina Hinshaw and Dr. Theresa Tam are advising us. So what are those preventive measures? Wearing a mask, washing our hands, good hand sanitization, and keeping socially distanced. It's all good advice, but how do we put that into everyday practice? How do we incorporate that into everyday life? And to start with answering those questions, I'm going to ask Eric to introduce himself and tell us about how he protects himself and how does he handle himself outside his home.
Okay, good day everybody. My name is Eric Dyke, and I suffered a T2 complete spinal cord injury in February of 2017 while traveling in California. Prior to my injury, I was in law enforcement. I'm currently retired now and a Canadian snowbird, spending my winters in Palm Springs. I live on an acreage in my own home with my partner and my emotional support dog. I continue to travel and enjoy life as much as I possibly can, as though I were not injured. I am a patient under Dr. Janice's care. I belong to many Facebook peer support groups for spinal cord injury where I gather a vast amount of my knowledge. I want to thank Dr. Beto and Dr. Janice for including me in today's webinar and all of you following us this afternoon. You want me to continue with how I handle myself?
Please.
First of all, I always wear a mask when I'm out of my home, and sometimes I wear a shield as well, especially if I'm in a grocery store or where I can't socially distance myself. When I go to a restaurant, I try to choose my own table far away from others. I have limited restaurant visits compared to before COVID. However, I still go out when I feel it's safe to do so. When I go into a restaurant, I ask the server if anyone needs to sit close by me that I would like my food packaged for takeaway. This has never happened. I find most establishments are very helpful of my space and do try to accommodate. The key is to let them know your concerns before seating you at a table. I try not to touch a menu. In fact, I view most menus online in advance of going to a restaurant. I'm finding that many restaurants now have their menus fully online. I hand sanitize every time I touch a menu or a table item. I also carry Kleenex with me, and I use it to pick up condiments from the table. When I'm shopping, I limit myself to shorter visits and less frequent trips to the grocery store.
Thank you, Eric. Now, that's when you're outside the home. I'm wondering about how do you keep your home environment safe? Because, of course, when you're out, you're exposed, you're keeping yourself safe. What do you do when you come home? And how do you keep your home safe?
Yeah, in my home environment, we do daily cleaning. We wash down all hard surfaces, knobs, handles in the kitchen, my office desk and bathroom. We use just common household cleaners such as Lysol or sometimes Spray 9. When visitors come to our house, I have a sign on my front door, basically right at the doorbell, telling visitors they must wear PPE, wash their hands, and wear a mask. We don't allow any exceptions to this rule at all. I also want to add that Alberta Health Services has a program for self-managed care clients whereby I'm able to order gloves, hand sanitizer, masks, and shields. I simply complete their form, email it in, and the items are delivered to my home within a few days. I order twice a month, and I have to say AHS is extremely generous with supplies. I learned about this through, I believe it was CBC or CTV had a news article on it. And so basically I just contacted my home care provider and they provided me with the email address and a form to complete. So I do that every couple of weeks.
Thanks, Eric. So how we live outside our home and how we live inside our home clearly has changed with this pandemic. And we've developed a lot of new habits to keep ourselves and those we love healthy. Now, everything with the social distancing, we've become more socially isolated, in large part, thank goodness for the technology we have and the social platforms we have to use to stay in touch with people. But this is not an easy time. And now, as much as ever, self-care and a positive attitude are really important to help us today and to get through this pandemic to whatever our new normal is going to be. Eric, could you tell us a little bit about what you're doing to stay positive and what are you doing for self-care? What are you doing to stay connected and for leisure and for fun?
Well, I still travel, probably not as much as I used to, but now I basically am traveling to visit family members. So I travel quite often. When I book a hotel room, I always ask them in advance when I make my reservation how often they recycle the rooms. So I like to hear that the rooms are not used for 3 or 4 days in between guests. So if I hear that, then I usually book with that hotel. If they don't recycle rooms, I just move on to another hotel. I always ask them how the rooms are sanitized. If I feel comfortable with it, then I'll go ahead and I'll book. I treat every hotel room as if COVID was in there. So when I enter the room, I clean all the hard surfaces. I place the TV remote control in a Ziploc baggie and sanitize the room key, and I try not to touch any of the hard surfaces.
When you arrive in the hotel room, are you also turning on the air conditioner, opening the windows, ventilating the room?
Usually I put the air conditioning on. It's harder for me to get to a window opening to open it, but I usually do put some sort of the air, either heat or air conditioning on. And again, I would touch the thermostat with a Kleenex or I would have a glove on.
Great. Those are really, really important. And I'm so glad to hear that you're getting out and about, traveling, so that you clearly demonstrate that there is a way that life can still go on, and traveling and visiting family and friends is still important and still possible, even with a change in how we might do things. Now, if you were to get sick, do you know what to do?
I would, if I were to get sick or needed to go to the hospital, I would still go there. I would probably contact my family doctor first to get advice, but I would still go to the hospital if need be. In fact, I recently just had an emergency hospital visit whereby I stayed overnight. And it was quite alarming to me because not all the nurses were wearing masks. They appeared to be wearing them, but many of them were wearing them under their nose or under their chin. And I was not afraid to ask. I was not afraid to ask them to wear their mask. And sometimes they were a little like shocked that me being the patient was asking them. But, it's my life and it's my life of the family. And I want to make sure that I'm protected. So no matter what, one thing I've kind of learned through all this, as Canadians, we're very polite people and we tend to want to do things in a very polite way, but you have to balance politeness with the worry of your personal health. And I've become not afraid to ask questions or demand social distancing in a very polite way. It can easily be done without offending anyone, and I simply say that I am in a high-risk category and therefore have to take extra precautions. So I start by wearing my own mask and then ask others to don one as well.
You bring up a really important point, and that is advocating for yourself. And by advocating for yourself, you're also advocating for everyone around you. Because I'm sure I'm horrified to hear that news about improper mask wearing in a hospital, when this has been emphasized over and over again to the point where HS even has a daily, it used to have a daily and now a weekly, mask tip blurb. And by speaking up, good on you for doing that. And yes, as Canadians, we're not as likely to speak up, but I always like to think of it as if I have this concern, I'm sure that everyone else has this concern. And if I don't speak up, there may be nobody speaking up. So I'm speaking up not just for myself, but for the person I'm speaking to as well as everyone around me. So that's really, really important. And thanks for bringing that up about speaking up at the hotel, speaking up at a restaurant, speaking up even in healthcare where we're supposed to know better. Now, specific questions. How are you keeping yourself? How are you keeping yourself healthy? You're on mute.
Am I unmuted now?
You're unmuted. Oh, you're muted again.
Okay.
There you go.
So basically, looking after myself, I follow the guidelines. I watch Dr. Fauci a lot. I like watching him. I get good advice from television, from other support groups, but I wash my hands quite frequently. Anybody coming into our home, we make sure they wash their hands several times. My caregiver washes probably about every 20 minutes to a half an hour. That's kind of how I keep myself safe. I wear my mask whenever I'm out in public. I also wear a shield quite often. I think I'm doing what I'm supposed to be doing, but I do have a question for you. If I were to go to a hospital, what should I do regarding my LVR or my CPAP machine? Should I be bringing those with me to a hospital visit?
Good question, because lung volume recruitment, those are the breath stacking exercises with the bagger, tubing and a one-way valve and a mouthpiece. Those are the range of motion exercises for the chest wall for people with thoracic level spinal and cervical spine level injury, to keep your airways open and reduce your risk of getting ill and catching pneumonia, keeping a nice clear airway. And the CPAP helps you, or if someone were on BiPAP, those machines help keep you breathing through the night. And without those, as a high spinal cord injury, Dr. Janice's rule number 1, breathing isn't an option until you're 6 feet under. So you need to breathe, you need to do those range of motion exercises. And if you're going into hospital, you're more likely to be, for those gas exchanging air sacs in your lungs to be compressed, you need to open them up. And lung volume recruitment exercises and CPAP or BiPAP are aerosol generating medical devices. So in other words, if you're using these devices, you're generating aerosols that theoretically, if you could be, it would increase the risk of wherever you are in a hospital or an emergency room for spreading COVID-19 if you were infected. So there is great caution about the use of these aerosol generating medical devices in the emergency room, in the hospital. And therefore, yeah, you need to take these with you because you need to do your range of motion exercises. You need to breathe when you sleep. Some people need support even to breathe when they're awake. And again, that's another aerosol generating medical device, unless they are trached and cuffed with a closed circuit tubing system to their ventilator. So in that case, if you have to go into the hospital, it's best to call ahead. And very likely they may say, oh, no, you don't need that. Leave that home. You're not allowed to use it. Also for people who are on nebulized medications for their lungs. This is another medical aerosol generating medical device and won't be allowed in the emergency room and may not, and very well likely may not be used in the hospital. So how do you get the medications into you? I mean, these are key things. So when you or your caregiver need to speak up and say, yes, I need to bring these in, you can call in advance to the emergency room or have your caregiver call in advance. Another option is if the doctor you're speaking to who's sending you into the hospital knows that you're going to hospital and knows that you're on these aerosol generating medical devices, they can call and notify the emergency room in advance. Because not everyone, not all emergency room doctors, internists, intensivists, and pulmonologists truly understand the need of people with spinal cord injury to do their range of motion exercises regularly, do their coughing exercises, and to breathe when they sleep with their PAP devices. Not everyone understands this. So having someone call in advance helps. And if it really looks like you need to be admitted, there's a mechanism that we doctors have through a process called Rapid, where we speak to someone who can arrange an admission directly to hospital, where they can immediately find a room in a negative pressure room for you to use your necessary medical equipment until such time as it's confirmed that no, you do not have COVID-19. But you need to speak up for yourself. You need an advocate to speak up for yourself. You need your physicians to speak up for you, because again, it's not broadly known that, people think, oh, well, people have sleep apnea, it's okay for you to go a night or two without your support. Well, that might be true for someone without a neurological condition, but not for those with neurological conditions. In fact, were you told anything at the hospital you went to when you were there overnight about your CPAP?
Yeah, I was basically told I could not bring it into the hospital, and I was told by the nurse that they did not have pulmonary people on staff or that they would lend the machine. So basically the nurse just said it's going to be a long night for you. And obviously I was afraid to fall asleep in the emergency because I'm dependent on my CPAP machine. And it's basically for that reason. I always carry your phone number with me so that I know that if I am admitted, that I can call you or pass on your information so that you can advocate for me, because I know how important it is to have a CPAP for me. Also, Dr. Janice, I have another question for you too, and that's to do with masks. Is it okay to reuse a mask? And also, how would I clean it if it's required?
Good question. Especially if we're going to be wearing masks for the next 2-3 years. First of all, we all need more than one mask. And it also depends on what kind of mask you're using and what kind of exposure you have. So one of these masks that's been distributed by Alberta Health, I think they've distributed as many as 40 million to Albertans. This is a disposable mask. Now, if you're only touching it by the ears and you're wearing it and you keep it clean, in other words, and you can take it off, you can just hang it up or put it in a paper bag for storage. You can't wash it because it destroys the integrity of the material it's made of. But if it's wet or dirty, you have to toss it. If you're going into like an outdoor area where you're not exposed to that many people, you could reuse it. But if there's a lot of people, you've seen people cough near you or sneeze, you don't need to take a risk. Throw it out, use another one. Now, it's nicer with these masks, the homemade cloth masks, which are increasingly available at a variety of sources online. You can even pick up a variety of masks at your local farmer's market, because there are many booths opening up where they're also, people are making masks right, left, and center. And what's nice about this is you can just toss it in the wash with, you know, in warm water, hot water, and dry it in the dryer with the heat. That'll kill any virus that's been exposed to this. And certainly you should be cleaning it if it's dirty, if it gets wet. If you didn't use it very long and there wasn't a large exposure when you were outside, you could probably just hang it up or keep it in a dry bag. We don't recommend using any, like a plastic bag or a Ziploc, because that retains moisture and the virus likes moist areas. And if you have picked up a droplet, a contaminated droplet, and you put it back on your face, you just exposed yourself. So best thing is one of these masks, clean it. And now there's talk about, you know, style and fashion statements that you can make with your mask so that it can match your outfit, or maybe you'd prefer, you know, and they're different designs. So people who are wearing hearing aids or don't want to risk losing their hearing aid or their earrings, there are other masks that you can use that go over the top of your head and then tie at the back, so the back of your ear is free. Or a lot of people, there are sashes with 2 buttons, or these plastic devices so that you can, you don't have to have the earpiece directly behind your ear, because if you're out and about for a long time, it can get sore behind the ear, and you don't want skin breakdown. It's not comfortable. So this is another device that's available. Some people are just taking pieces of cloth and sewing on the buttons. And remember, if you're out and about and you have to wash your mask, you'll also need to wash those, the sash with the 2 buttons. And this can easily be cleaned with your Lysol wipe or alcohol. Do you have any other questions, Eric?
No, I don't think I have anything else to add. Thanks for answering.
Great.
My pleasure. So in summary, the pandemic is still with us. It's going to be with us for a while. We can't let our guard down. So at this point, I'd like to open up our conversation, our questions answered, any comments, ideas to everyone who's attending.
Sure. Thank you. Thank you very much, Janice and Eric. This was very, very useful. There are a couple of questions so far, but before that, I will take a time just to. We forgot to post the poll, the initial poll, so we will do that in a minute right now. So if you just take a minute to answer it, you can also answer it, Janice and Eric, if you want. Where are you? I know you are outside of Alberta, Eric, so it's interesting to know that we're reaching out outside of the province at this moment. And you it just take a couple of seconds. Okay, so we're back. And the 2 questions, so the first one is about the form that you were referring, Eric, for the self-managed care program. And this question was posted by Casey, so I will allow her to reply, but first, can you just address a little bit more information about this form and how does it work?
Yeah, it's just a form. It was designed by Alberta Health Services, and you just basically, it's just filling your name and your address, your shipping address. There's, as far as I know, they don't even check with your home care people. They just send you stuff based on what you order. So I've been getting hand sanitizer, I've been getting gloves, I've been getting masks. They even sent gowns in my first order, which I cross off now because I don't require the yellow gowns in my house, but they've been very, very lenient, and nothing has really been refused, and it just shows up a day or 2 after you submit the form. I can find the email address here. I'll look for it while we're online here today, but basically it just comes from your social worker or home care people.
Thank you very much. So Casey, do you want to reply to that, or?
I just wanted to add that if you have any questions, contact your home care case coordinator. If you need for advice on obtaining equipment and supplies, they are your best resource.
Gotcha. So Casey, you can talk, like if you just keep pressing the space bar, you can unmute yourself.
Hi, Beto. Yeah, thank you. So Eric, I did hear you speaking about that form, but I wasn't sure. Was it just because you're a self-managed care client and you were looking for those supplies like the PPE and hand sanitizer instead of going through, you know, your vendor when they deliver your equipment anyways?
Yeah, my understanding that it is for self-managed care clients. I'm not really sure about other home care clients, but definitely for self-managed care. It's written right across the top of the form for self-managed care clients in Alberta.
Thank you.
Thank you. So the second question, I think this is a very interesting point of reflection, and it's about that piece of the advocacy that you're talking, like Eric and Janice, about. You need to ask your health providers to pick up, and Brandis is asking about what is the number you will call prior to going to the hospital to arrange all these things. And she said that she called HealthLink and spent 55 minutes on hold. I have gone through similar things myself. So I don't know, Brandis, do you want to expand a little bit more on that experience and on your question?
Sure. So, I mean, HealthLink in general, I know that they have that out there so that people will call HealthLink before to go to the hospital, which is great. But if you're in an emergency situation and you call HealthLink and you're on hold for 55 minutes, what is that going to do for you? And the other aspect, you know, we talk about advocating for ourselves at the hospital. And while this is being thrown out there that we should do that, I find it hard to believe that they would listen as much as you guys are saying that they would listen, because I know when I've been in the hospital for something very simple, being able to get someone in the room with me is hard, being able to advocate for the proper medication is hard, and I speak out about things, so I just have a hard time believing that they would be that lenient. So there's that, and then yeah, like Beto said, where would you even call? Like if you're trying to call your specialist and it's on the weekend or it's, 11 o'clock at night, they're not going to answer. You're going to leave a message.
Oops, I can't hear you.
Sorry, Brandis, you were muted at some point. So can you just repeat the last part?
Connection. But Brandis, you are absolutely right. We have to change the culture. One of the reasons that I stay very connected with the people I look after is because I know they are very susceptible, they're very vulnerable, and most people do not understand the need for this equipment, these supports, having a second person in the room with you, because they look at, what are the rules? And it's hard to speak up. But if enough people do this, my hope is it will change. And I'm working really hard on changing the culture with the next generation. You're right, it is hard. And being on hold for 55 minutes when you're supposed to be en route to the emergency room is really difficult. So strategies. One, that you discuss with your specialist, hey, I'm high risk, how do I do this? Can I call you? Or who do I call to let them know? Or take it into your own hands, or have your caregiver, while you're en route, have someone else call for you. You call the main number of the hospital and say, may I be transferred to this is so-and-so, I need to be transferred to the emergency room triage nurse. You heard the voice. And then you get on the phone with your triage nurse, or your caregiver say, Brandis Lorch, his number is going into the emergency room and she requires assistance with, and she's she's going in with her lung volume improvement or a mechanical cough assist or her BiPAP or her mouthpiece ventilator. These are aerosol generating medical devices. She needs these to breathe moment to moment. She can't leave these at home. Just giving you the heads up so you can plan in advance. And she's going in with X symptoms of a urinary tract infection which can't be treated at home, or she's going in with a possible chest infection. And then someone might say, well, maybe she should go straight to the ward. At that point, if it's you or a caregiver, the issue will be, it has to be doctor to doctor, nurse practitioner to nurse to healthcare provider through Rapid. Most of the time, I'm anticipating they'll just make allowances. And if they say, well, we don't allow people to show up with this, you can say, well, this isn't a matter of allowed or not. She's showing up, she's already on her way, and she's got her equipment. You might want to call the respiratory therapist in advance, or you might just want to notify the unit manager of the emergency room that Brandis is coming in with a care provider who must be at her side at all times. Beto, this gives me ideas for another project in spinal cord injury about having maybe some sort of sheet that goes in with your green sleeve, because we're all supposed to have a green sleeve about, you know, our preferred goals of care, our choices, the important contacts. And maybe if we have, you know, I live with spinal cord injury. If I show up in the emergency room, I need X, Y, and Z, contact so-and-so if there's a problem. So HealthLinks is just a referral base. They aren't connected to any specific emergency room. The best thing though is if you can reach a healthcare provider, maybe even your home care nurse, your home care case manager, to call the emergency room in advance. Now, I know that outside of Alberta, the culture in healthcare is to be calling left, right, and center. That isn't yet, since I moved here, it doesn't seem to be the culture here in Alberta, and it makes all the difference. So if you have a home care nurse or a home care case manager, you call them, or the, community care access, whoever's on call, to say, I need to go in and maybe ask them. I don't know if that would work, but when you have to go into a hospital, you need to go into a hospital. And maybe
I absolutely agree with that. I totally agree with everything that you're saying. And I commend you and Beto for how involved you are with your patients. It isn't like that everywhere, unfortunately. It would be great to have on-call physiatrists for stuff like this. I know there's people out there like myself, we don't use self-managed care, we don't use home care nurses, so we don't have that either, right? That's a personal choice that we've made. So, I mean, if there could be some sort of change, and I know change is very difficult, you know, to have.
Bring up a point that says we need to change. And Eric, you too, you brought up the point, you were told CPAP has to stay home without recognizing, well, you need this to breathe. If you go to sleep, you're not breathing. So, Beto, I think we need to take this point that Brandis is, very important point that Brandis is making, and problem solve, not just for our local community, but all of Alberta. And hopefully by changing the culture of care, you won't have this. And being on the line for 55 minutes when you're talking about going to the emergency room, that scares me. Because for many of the people I look after, they don't have 55 minutes. Mind you, most of them already have the action plans in their home to start while someone's on the phone or they're en route. But we also need to educate the paramedics, the emergency room staff, the internists, the family doctors, the pulmonologists, and the intensivists.
Yeah, I totally agree with that. And we will need to talk further and discuss further how can we change this culture. But I would say that in the meantime, Janice and Eric, I don't know what you feel, but in the meantime, that piece of this is a reality, so you need to advocate for yourself. So you maybe the recommendation is find that health provider who you trust the most, right? And test it, right? Test that relationship. And it could be, as Janice said, could be a home care nurse, a nurse practitioner, your physiatrist, your family doc. But if you have that person that you trust, and then actually, I think it's a good idea to contact that person before you have the situation and tell, hey, I think that I know what is, I went to the Alberta SCILS seminar and this idea emerged about having the support of our close health providers. If we are in the position of going to emergency department with our equipment, like with our respiratory equipment, could you be willing to, or would you be willing to establish a plan with me? So if that happens, how can we can make that? So I think that's one of another recommendation. We have another comment and question about the green slave. Sorry, green slave. Sorry about my English there. So the green slave, and this is from Mike de Groot. So Mike, if you want to, he asks, how do people get the green slave, as he had an experience with this issue. So Mike, if
okay, hi, thank you. This is actually Mika.
Mika, sorry.
No problem. And in the past, I wanted to have the green sleeve and get that for some of my clients. I work for SCI Alberta. And there is some information available online. This is the way that you organize the green sleeve. This is what's in the green sleeve. This is how you get the green sleeve. So I followed that process, and I was told it was available through the public health unit. So when I contacted the public health unit, they were not able to help me. How does a person get the green sleeve?
So this is widely available, but it's a document that has to be signed by a medical provider, either a medical doctor or a nurse practitioner. So it's a document that translates into fast medicalese your wishes. So it requires a conversation with the medical doctor or the nurse practitioner who's going to sign the form, indicating what your goals of care are. And it's a communication tool, really. And keep in mind, it's not fixed in stone, because it's just, at this point in time, under these circumstances of my medical condition or your medical condition, this is your preference. So it's not that the layperson can get the form and sign it themselves. That is a personal directive. That's a different document. But the quick medicalese communication tool for overall, what are your goals of care? Are they resuscitative, medical care, or comfort care? That is a medical form. All family doctors have access to this. All doctors have access to this. Even specialists have access to this. But it's a documentation of a conversation that has occurred between a healthcare provider, medical doctor or nurse practitioner, and the client or the patient. So it's not something that you can just get the form and hand it out to different people. I mean, they can have it, but then they have to go to a doctor or a nurse practitioner to have that conversation. And when I have that conversation with people, I'm not saying, what are your goals of care? I'm asking about, let's review your medical status. What's most important to you? What do you want? If this goes wrong, that goes wrong, or this happens, what do you want? How do you want to be looked after? Who speaks for you? All of that. And then I translate it into, oh, this sounds like you want everything and that you're okay with going to the ICU. Or, it doesn't sound like care ICU appropriate, or being really aggressive care, resuscitative care isn't going to change your quality of life. Let's do medical care. Or you know what, you're at the very end stage, or you've had it. You don't want anything, any approach or treatment unless it gives you comfort. So after I have that conversation, I then say, okay, so this is what I think what you're telling me is. And then I say, this sounds like, whatever the category is and the level. And then I write it down. And I frequently photocopy, or I can now document things in Connect Care, and the photocopy can be scanned into Connect Care. But for people themselves, clients to have their own copy, they just have to go to their family doctor and say, I'd like to have this conversation. I'd like to talk about my medical status and what is important to me so that I have a documented medically communication tool of my goals of care.
Okay, thank you. Questions coming out of that, Janice, include, does the doctor then have the form? And the other question or observation is that through the process of trying to best help my client, there was one person in particular that I would use that to teach myself how to help others. I ended up speaking to a lawyer's office, and they said that the personal directives that are available are only worthwhile once they've gone through with a lawyer. Mm. That we should not count on the personal directives that a person could find online and discuss with their family doctor and have placed on their file, that that's not going to guarantee that a person's wishes are looked after.
Yeah. So there's something, a personal directive is different than the goals of the green sleeve goals of care. A personal directive, I think I refer most of my patients to a social worker to help them with their personal directive. I'm not sure that, I mean, you can go to a lawyer, but I'm not sure that going to a lawyer is absolutely necessary. I will need to confirm that. Because again, if it needed to be a legal document and you have to pay for it, that's not broadly applicable. And there are Canadian templates for personal directive, and there's a wonderful Alberta Health Services website on conversations that matter, choosing your goals of care. That is an excellent website that just explains the different goals of care. So goals of care and the green sleeve, the goals of care document also has another document that tracks the conversations over time. So the green sleeve has the goals of care, the quick communication tool. It should have the tracking the conversations. And then if someone has a personal directive, a copy should also be in that, that green sleeve.
Yeah, so we have only 2 minutes. I think that's those are very important points to clarify, Janice. I know, like, as you know, like goals of care are something that is enacted once you're in the hospital, like legal or not. Goals of care are like lawyer or not, sorry, goals of care are enacted in the hospital, right? So that's it. And for that type of life decisions or life support decisions, it's enough. But
the goals of care, though, that it can be enacted in the home, in supportive living, long-term care, or in a hospital. It can be written in advance in the family doctor's office. If I'm meeting someone and I might know more about the medical aspects of someone's respiratory status, but the person I'm talking to has a 20-year relationship with their family doctor, I recruit the family doctor to get involved because, you know, who's meeting me, or maybe they only know me for a couple of years, they have a long-standing relationship. And then I'm happy to talk with the family doctor, and usually it's in my note, you know, this is what we discussed. These are the issues. Would you please continue the conversation?
Sure.
But goals of care is a communication tool. It's not a legal document, and it can change. It's not written in stone.
Yep. Well, I'm aware of the time, so we have 1 minute left, and I just want to say thanks to our presenters. Eric posted a comment here that says that asking if there is an on-call physiatrist for people with spinal injury in our province. No, not to my knowledge, and that's a good idea. And that's something that we can continue to discuss in the future. And he also said that he feels that he feels that if he would have called you, Janice, you will have advocated for him. So that's the point. Like we find that provider that you trust, that you have those relationships, right? So that's the importance of the relationships. And he also asked, like,
another thing, back to Brandis's point, that if you don't have a doctor or a nurse practitioner or a caseworker or a nurse, a home care nurse, have another friend or family member who speaks up for you. Because when you're not feeling well, it's really hard to advocate for yourself.
Yep.
You delegate that. Find someone who you can delegate that role to.
That's a good point. Eric also finishes with a question here for you, Janice. Like, can you explain quickly, in a minute, the oxygen sensor and what the oxygen level should be, as well as the temperature level?
So this pulse oximeter, this is readily available, at your local drugstore, Walmart, London Drugs, Shoppers. You can get it through an oxygen company like Vital Air, Medigas, or Respiratory Home Care Solutions, Parkland, any of those. Most of them will sell these gadgets. You can even order them online. Do not order the $14 or $20-something, $24 gadget if you're going to get it. And what it does is it's a probe that fits on your finger, and it will give, once it tracks my pulse, it will read my oxygen saturation and my pulse rate. Mm-hmm. And it's a handy dandy gadget that if you think that you are at higher risk because of your respiratory status, ask your doctor for a prescription for this. Not that it gets covered or anything, but you can then purchase one and use the prescription and the receipt to claim on your as medical expenses on your taxes. And it's quite useful. And it's like a thermometer. It's a thermometer for the respiratory system. It gives good information. But and it should be, I like to see, in general, I want to see that the oxygen saturation is above 90%. Normal is 96 to 100%, but it depends what else is going on.
Okay, so 90%.
Heart in the brain, above 90%. Heart in the brain likes greater than 90%. But again, it's a complex question, because there's some people where I say, for you, you need it higher, or for you, I'm okay if it goes down to 88% when you're doing absolutely nothing. You're not stressing your heart, your kidneys, or your brain. But the brain really likes its oxygen, as does the heart.
Gotcha. So, but as a general rule, 90% should be, if it's lower than that, they should worry.
You should worry, and also look at the heart rate. And look at the pulse rate, because if it's a low number, but the machine's not the gadget isn't picking up your heart rate, it's not an accurate measure. Mm-hmm. Main reason I would worry is if, you're not feeling well, but you don't notice any breathlessness, you think you might be coming down with COVID, and you're now 85% or 82% or 78%, get yourself to the hospital. Okay. But if you're going, call in advance, call the ambulance and let them know, I think I might have COVID. So that the paramedics, we want to keep our paramedics safe. One of the biggest things we have achieved in Alberta is we have not overwhelmed our medical system, as has happened in other countries and in other provinces. The key thing, yes, we may be living with the pandemic for a long time, but let's keep ourselves safe, and let's keep people who look after us safe.
Great, thank you. And what about the body temperature? You think is like for fever? 38, 39.
37.5. Again, most people out and about, it shouldn't be higher than 37.5. That starts to be a low grade. 38 is a low grade fever. 39 is a high fever.
Yeah, 39 is a good cutoff, and say you actually do have fever, right?
38 low grade. Again, it may be a telltale sign for a urinary tract infection, but it's not necessarily, you could have a normal temperature and still have COVID pneumonia.
And that's a very good point, because for people with spinal cord injury, as we know, if you get a fever, the first thing that they're going to think of is about a urinary tract infection. I think in these times of COVID, any fever, you are a good candidate to get the test, because that's what we do. Like all the essential workers, we do this questionnaire, and just the presence of fever tells you that you need to self-isolate and you need to do a test so to confirm it. So I think that's a good way to go.
And thank goodness in Alberta, we have ready access, whether we're symptomatic or not, to be tested,
yep.
which is going to make a huge difference for contact tracing and preventing outbreaks.
Yep, yep, perfect. So it's 1:05. Sorry, we run longer, but of course the topic, we knew it was going to be a hot topic today. Thank you again for the presenters. Let me just remind you. Let me share my screen about the rehabilitation advice line again. And if you have more questions, you can address them to this. This email address here, so we can make sure that we answer all your questions, because I'm sure that they're going to pop up after we finish this. And finally, we will have our poll. The only thing is I need to be able to stop sharing, and I don't know what is happening. Oh, can you see the poll in there?
Yes.
Oh, good. So please, if you just take a minute to do it. And otherwise, thank you very much to everyone, and we will connect soon for our next webinar, which is going to be on August the 21st, and is going to be about research. The promotion material is yet to come, but it's going to be about research in spinal cord injury, specifically for this province. So I'm stopping sharing. Thank you very much. Thank you, Janice. Thank you, Eric. And we'll see you soon. Stay safe.
Thanks.
Thank you, everyone.
Bye.